Like others, I'm disappointed we're not going forward today to sustain the president's veto, an outcome that I think no matter how much time anybody has in the timeout chair will be the result. If we were moving forward today and sustaining the veto, then we could get together and try to have a bill that does what I think all of us want to do. Now, all of us don't want to do everything, but all of us do want to do some things. You know, we all want a program that meets the needs of poor kids first. That's why when we put this in place in 1997, we said, look, kids whose families are at the poverty level or below, they have access to Medicaid. But what about people who are working, kids whose parents are working and are working in jobs where they don't likely have access to insurance? Let's prioritize those kids. As a minimum, whatever we do as we move forward, let's have a standard that the states have to meet. The administration proposed 95%. Chairman Barton, Mr. Barton proposed 90%. But some percentage of kids whose families are in those jobs that may not have access to insurance. Before we go on and just simply talk about insuring more kids, this should be a program that's focused on poor kids, not a program that's on more kids. You know, some of our friends say, well, if a program that would give health care to poor kids is a good thing, a program that would give health care to all kids or more kids must be a great thing. And it's just simply not accurate. Things that destroy the private insurance market, things that don't meet the needs of the program before you move on to do more, are not the kinds of things we ought to be focused on. We need to be sure that we're covering people who are uninsured, not people who are insured and then moving from insurance to government-paid health care, Washington-based health care. You know, there are going to be situations, I guarantee, if we start insuring all the kids in America or all the kids that this bill says that we're going to insure, where moms are going to wind up in houses that have both a mom and dad as the only person not insured. I mean, think with me for just a minute. Dad has a job. Insurance comes with dad's job. The government comes in and says, we're going to insure the kids. Who gets left out then? It's mom. Our mom has a job, and she's been struggling with the job she has to figure out how to insure herself and the kids because insurance didn't come with the job. And then the government decides to insure the kids. Mom says, well, maybe I don't need insurance anymore. And some of our friends will say, well, that's why we're insuring adults. This should not be a program about insuring adults. One of the reasons this program hasn't worked as well as it should have is too many states moved to insuring adults before they'd insured poor kids. Let's get on with this debate. I regret the fact that we're not able to start tomorrow because we went ahead and did today what's going to happen in 2 weeks. But let's get on with this debate. Let's be sure we provide a stable funding source for a program for poor kids, and we put poor kids first in a program that's supposed to be about helping kids whose families are working, but working in jobs that aren't likely to have insurance. I yield back.
Gentleman yields back his time. The gentleman from New Jersey.
Madam Speaker.